In this video, we will be demonstrating donning and doffing high-level personal protective equipment for the Special Pathogens Unit at Providence Sacred Heart Medical Center and Children's Hospital. The donning and doffing processes are step-by-step procedures that incorporate high-level infection control and ensure healthcare worker safety. Both processes should be done in a systematic manner utilizing checklists and a trained observer. For the donning process, you will need the following equipment: a powered air purifying respirator, a comfort strip, a battery, a belt, a level 4 PAPR hood, a bouffant cap, if needed, internal boot covers, external boot covers, a level 4 coverall, extended cuff gloves, internal and external, and an apron. After changing into hospital scrubs and Crocs, the caregiver should use the restroom and return to the donning room. The caregiver will then take their temperature and sign in on the staff log. All personal items such as watches, jewelry, cell phones, and name badges will be removed prior to the donning process. Hair and eyeglasses will be secured. First, you will perform hand hygiene with alcohol-based hand sanitizer. Make sure the PPE is free of defects by inspecting each item. Apply the belt and ensure the clip is facing up. Make sure the belt is snug fitting and secure the tail of the belt. Apply the battery to the belt on the left side. Plug in the PAPR. Ensure the battery indicator light comes on. 5 lights will come on, the red and the yellow will turn off, and 3 lights should remain indicating full battery strength. Apply the comfort strip. Check that the fan is on desired setting. Disconnect the battery. Apply the hood to the helmet and then set aside. Don bouffant cap if needed to secure hair. Don inner boot covers. Don your coverall to your waist. Don outer boot covers. Perform hand hygiene. Don your PAPR by plugging in the cord and lift the tabs on the hood for easier application. Secure the cord under the battery and make sure the cord is behind your left shoulder. Make sure the PAPR fits properly by tightening the knob and shaking the head yes and no. The assistant will then tuck the cord into the belt on the back. Don extended cuff internal gloves. Next, you're going to finish donning the coverall. Pull the cuff of the coveralls over internal gloves. Secure with thumb or finger loops. The assistant will zip up the coverall, secure the Velcro at the top, and remove the tab adhesive to cover the zipper. The assistant will straighten the hood and tie both sets of ties in the front. Don the extended cuff external gloves. The assistant will tape the cuff of the gloves to the coverall. And tie the apron in the back. The assistant will inspect the PPE ensemble as the staff member turns 360 degrees. The assistant will read the safety instructions to the caregiver. Keep your hands away from your face. Limit the surfaces that you touch. Sanitize your gloves immediately if they are soiled. Take your time. The doffing assistant or the monitor will maintain visual contact with you at all times. Ask for help or coaching if you need it. If you have a PPE breach, notify the doffing assistant and proceed to the doffing process.
Hey Krista.
Hey Rick.
I'm ready to doff out.
The doffing process begins when the caregiver communicates to the doffing assistant through the video intercom. The doffing assistant will watch as the caregiver follows the instructions on the sign. Using the mirror, remove the apron starting at the neck. Let the apron drop, then remove from the waist and pull out, rolling from the inside. And then discard the apron. Perform hand hygiene. Doff the outer pair of gloves. Perform hand hygiene again. Obtain a disinfectant wipe and wipe off the door handle with the wipe. Open the door with the wipe and proceed through the door to the red square of the doffing area.
First, go ahead and stand in the red square while I'm off the floor.
The doffing assistant will physically assist with the doffing process and will be in the same PPE ensemble as the caregiver that is doffing. The trained observer's role is to read the checklist, guiding the caregiver and doffing assistant through the doffing process, while monitoring the process to ensure safety. The trained observer will be donned in a gown, mask, gloves, and eye protection, and will stand in a designated area to maintain visualization of the process. The trained observer will read the following safety instructions. How are you doing? This process will be slow and methodical. I will talk you through every step. Please do not proceed without my instruction. Please keep your hands away from your face. The assistant will watch as the team member turns slowly in 360 degrees to check for any visible soiling. If soiling is present, talk through the breach processes. Doff your tape gently and discard in the garbage. Doff your external gloves using glove-in-glove technique. Perform hand hygiene. The assistant will get 2 wipes. They will use the first wipe to wipe in downward strokes on the face shield and discard. The second wipe will wipe the hood, covering the shoulders and back of the neck, avoiding the chest area. Using firm downward motion, and then discard. The assistant will use hand sanitizer. The assistant will have 2 pieces of tape prepared for the hood. The assistant will untie the hood and discard the ties. The staff will slowly turn in a circle while the assistant rolls up the hood tightly.
Okay, Brett, go ahead and slowly turn to your left.
And the assistant will use tape to tape the hood on each side of the head.
Okay, keep turning.
The assistant will use hand sanitizer. The assistant will unzip the coverall and assist to roll the coverall down to the waist, touching only the inside.
Okay, Brett, go ahead and turn around. I'm going to roll this down to your waist. Then they have you pull your right arm out. And now your left arm.
Doff the coverall, using the stool if needed. Outer boot covers will come off with the coverall. Touch only the inside. Gently roll it into a small ball and discard. Both team members will perform hand hygiene. Both members will doff their gloves using glove-in-glove technique and gently discard. They will again perform hand hygiene. Both team members will don new gloves. The caregiver will sit on a stool in the red square and remove their first set of boot covers, touching the inside of the boot cover on the foot, extending the boot cover over the heel, and discard. They will place their foot into the yellow square without setting the foot down in the red square. They will doff their second set of boot covers in the same manner and place the foot down into the yellow square, remembering not to touch the red square with their foot. They will stand up and face the assistant. Perform hand hygiene. The caregiver will loosen the knob on their PAPR, bend forward, and remove the PAPR from the left side and hand to the assistant. The assistant will grab the inside of the PAPR, unplug the cord from the battery, and hand to the assistant. The assistant will remove the hood by rolling the hood off the PAPR and placing the hood in the garbage. The assistant will place the PAPR in the bin for decontamination. Both team members will perform hand hygiene. The staff will remove their belt with their battery and hand it to the assistant. The assistant will place the battery and belt in the bin with the PAPR. The caregiver will doff their bouffant cap and discard in the garbage. Both team members will perform hand hygiene, and the caregiver will doff their gloves and again perform hand hygiene. The assistant will stand in the corner out of the staff's path. The staff will get their mask from the table and don it. The staff will exit the doffing room and follow the shower protocol as written on the signs posted in the bathroom. The assistant will then clean the doffing area. First, they will remove the PAPR, battery, belt from the bin and disinfect them with wipes. Then they will place them in the plastic bag in blue labeled clean PAPR bin in the doffing room. They will then mop the floor, disinfect the chair, stool, and other surfaces, and process waste as necessary. The doffing process is now complete. Please remember the doffing process is slow and methodical and has team member safety as its main goal. The doffing process will always include a doffing assistant and a trained observer, guiding caregivers step by step through the process utilizing a checklist.